In general, when the patient with the worst outcome has the higher risk score, this pair is called concordant. Now, when the patient with the worst outcome, as patient A, does not have a higher risk score, the pair is called not concordant. With that information, let's try to determine whether the following pair is concordant. We notice that the patient with the worst outcome is patient C because they die within the next 10 years, while patient D does not. And patient C is the patient with the higher risk score. So we find that this pair is concordant. Let's next try to determine whether the following pair is concordant. We notice that the patient with the worst outcome, patient F, has the lower risk score, and thus this pair is not concordant. Finally, let's consider the case in which we have different outcomes but a tie in the risk score. In this case, we don't consider it concordant or discordant. We classify these as ties. Note that we haven't considered ties in the outcome. What if both patients die in 10 years, or both patients don't die in 10 years? Turns out we cannot use these pairs to determine who should have a higher risk score. Thus, in the evaluation of prognostic models, we only consider pairs where the outcomes are different. A pair where the outcomes are different is called a permissible pair. It's with such pairs that we can evaluate prognostic models. Using all of this information, we can now evaluate prognostic models by giving a score of +1 for every permissible pair that is concordant, and a score of +0.5 for a permissible pair that is a risk tie. In other words, ties are given half the weight as concordant pairs.